In this video, I will demonstrate the features in Lifelines2 designed to help users to flexibly create groups of records and compare these groups using temporal summaries. The medical condition Heparin-Induced Thrombocytopenia, or HIT, is the demo scenario. It is usually characterized by a 50% or greater drop of platelet counts within the first 5 to 9 days after exposure to heparin. Here I have loaded a set of 693 patients who were exposed to heparin and underwent HIT antibody tests in the 2008 calendar year. HIT test is used to screen for possible heparin-induced thrombocytopenia patients. The data here includes the following events. How was each patient discharged? The result of each platelet count tests, the result of each HIT antibody test, if a patient was treated using the drug argatroban, when was heparin administered, and when was the patient entered and exited each ICU unit. We will first create groups of patient records that better resemble the record of a typical HIT patient in ICU. We will then comparatively study the hospital discharge patterns of these groups. First, I use filter by number of occurrences on ICU in events to select patients who have been in ICU at least once. The highlighted records that indicate that they are selected by the filter, I click on Keep Selected and Save Record as a new group to save these records as ICU patients. We are now in the group ICU patients, which contains 450 records. I will now apply a second filter. Again, I will use occurrence filter, this time on HIT positive event. This selects all patients who have at least one HIT positive events in their history. Again, I will use Keep Selected and save these 93 records as a new group. I will call it ICU and HIT plus. We also want the group of patients in ICU but never had a positive HIT test result. So I will go back to the ICU patient group. I click on More Controls and select the ICU patient group. Again, I will apply the filter of occurrence on HIT positive events. But this time, I will click on Remove Selected and keep the remaining ones as a new group, which I will call ICU and no HIT plus. Next, we go back to the ICU and HIT plus group to specify an event pattern that suggests HIT. To do that, I will use the sequence filter. I first specify patients to have no platelet lower critical events, followed by at least one platelet normal or high events, followed by any kind of heparin exposure, followed by at least one platelet lower critical event, and finally a HIT plus event. And I will save this group as sequence. Now that we have these groups created, let's look at their discharge patterns in comparison view. We want to do a between group comparison, and we want to select the groups we just created. And we want to align all patients in these groups by their first ICU in event. Finally, we select to see the distribution of discharged alive and discharged dead. My cursor indicates the alignment line, and this aggregation is the granularity of months. The top temporal summary shows the distribution of both alive and dead discharge over time for patients who entered the ICU but had no positive HIT test results. There are 357 of them. The second summary shows the same data for those who entered the ICU and had at least one positive HIT test results, 93 records. The bottom summary shows the subgroup of the second summary that contains the sequence filter we previously specified, 63 records. Because the number of patient records in each group is very different, the aggregation needs to be normalized for meaningful visual comparison. To do this, I select Event Normalized by Records to divide the aggregation of discharge status by the number of records in each group. Since each patient is discharged only once, the bars indicate the proportion of patients discharged in that month. We clearly see that over 80% of the patients were discharged in the first month in the first group with no positive HIT tests. However, in the other two groups, the percentage drops down to the 50s. The discharge pattern in the second and the third group are also much flatter than the first. We also see that proportionally more patients were discharged to dead in the second and third group, especially in the first month. This visual exploration suggests that patients with HIT symptoms tend to stay in the hospital longer and potentially increase the cost for the hospital. The second question we have is, how will the zargatroban, the drug often used for HIT treatment, help these patients? We go back to the ICU and HIT plus group and create two subgroups. One with patients who were treated with zargatroban, call it HIT plus and ARG, and one with patients who are not treated with zargatroban. Again, we go to comparison. This time I selected two newly created groups, aligned by their first HIT positive results, and choose the platelet low critical event in red and platelet normal and high event in pink. We see that the patient with zargatroban on the top show visible improvement in the platelet test results. That is, in the first 5 days after their first HIT positive event, the proportion of platelet normal high, the ones in pink, steadily increase, while there's very little difference in the second group.